Hi there, my name is Jessica Hagg and I'm director of the Arlington Street Community Center. And today I have Robert Ortiz with me from Public Health. Hi, Robert.
Hi,
How are
Jessica. Good
you?
yourself? How you
I'm
doing?
doing well. Thank you so much for
Good.
being here with me. We have a lot to talk about today. We have some programs that we've been planning together. We have programs that we've already run in collaboration with
Yes, we
Public
have.
Health and the Arlington Street Community Center, and that's actually how we met initially. I think it was my second week of work. Was it July?
Yes, it was
Early
some
July,
early
right?
July. We met for the first time and we had a great meeting about
Yes.
community events and things to come up. And I was
Yes.
very excited to meet you. And
Yes, I was so
it's
excited to meet you too because everybody that I've met that told me about you, they said, "Oh my gosh, you have to connect with Robert. He's so
thank you.
passionate. He's so passionate. He's so knowledgeable. He really cares about the community and connecting
hmm
people to resources."
hmm
And so I said, "Okay, where is he?" And I'm like, "Let me find him." And I think the first time I was introduced to public health because I'm not initially from Nashua. I'm from
Oh,
Lowell, Mass.
nice.
So I didn't really know anything about public health here in Nashua until I joined this role.
hmm
And you guys had a nursing camp for
Yeah,
young kids at
we,
the center.
we did. We had a week-long nursing camp where we, set out a recruitment for children to join in on the summer camp.
Hmm.
And it was for children that are interested in healthcare or human services. So we got a group together, community health workers and nurses, and we created a curriculum where individuals can learn about anatomy and physiology, parts of the body, and discuss health sciences in general.
Right.
So
And they were young kids. They were middle school, high school, right?
yes, yes, very young. I think our youngest was probably in middle school as
Oh,
well.
yeah.
And they were very well informed, surprisingly. A lot of children, it looks like they're doing a lot of research and they want to reinforce that
Oh,
and learn about, trauma management.
right.
We talked about first aid and also about Narcan,
Yeah.
which is um, an issue here in the Nashua area as well.
Right, right.
So,
And it's good for them. It's good to start young with that because I
mhm,
remember, I think I was in eighth grade. I went to something similar, but it was like a babysitter boot camp.
mhm,
And so I learned CPR, I learned how to do the Heimlich on a baby,
mhm,
different skills that helped me as I went into the early childhood program in my high school. When they reviewed that, I already knew that. When I went to college and they're
mhm.
saying, "Oh, how many of you know how to do the Heimlich on a baby?" Not many people know,
Not many people.
So offering opportunities like that to kids, even when they're young, even if it seems like they're too young,
Mhm.
and they might even make the decision of, "Holy moly, every time we talked about blood, I feel sick. Maybe I don't
Ex-
want to be a nurse."
Exactly,
And it was
exactly.
packed. Like
Yes,
there was a full classroom every day.
it was the initial count that we had in the beginning.
Hmm.
It maintained throughout the entire camp, so that
Yeah.
was phenomenal.
And you guys made ice cream.
Yes,
Yeah.
yes. So
Yeah.
one of our public health nurses, Flavia, she actually knows the science experiment very well and made ice cream. So that
Yes.
was very good.
Yes. Oh my gosh, that was so exciting. What a great way to end the
Yes,
camp. Are there
absolutely.
any other opportunities for people to get involved in public health that they might not know about?
Absolutely. There's many ways to get involved with public health. We actually take in volunteers. So you can be a high school student or a college student or even a higher level, a nurse practitioner that wants to
Right.
join in and volunteer. Um, so a lot of the times you can volunteer with outreach
Mm.
or with clinical settings.
Wow, that's awesome. And
hmm
how do people go to the website to see that?
Absolutely. You can send us an email to the
Okay.
community health department
Hmm.
or visit us in person.
Perfect. Oh my gosh,
Absolutely.
thank you. I
Yes.
I always get so excited learning about new volunteer opportunities because I think that especially after COVID,
hmm
now that everything is pretty much back in person again, a lot of people are looking for ways to get involved, whether it's on the weekends or after work or their work schedule changed and they
hmm
want to help the community, and that's a perfect way to do that.
Absolutely. And we saw that during the pandemic when we
Yeah.
were doing the vaccine rollout. A lot of people in the community wanted to know how can they help out, how can they join forces with public health
Wow.
or like other agencies. So I feel like, the pandemic was difficult, but it also brought a lot of community response,
Right.
which is exactly what we're looking for, and we want people to be informed.
Right. And I think one of the biggest things, so I went to Rivier University, which is a
Nice.
huge nursing school,
Yes.
public health, nursing. And a lot of my friends who are in nursing found that there are some people who are scared of vaccines for different reasons, like cultural reasons, they're not quite sure, or even religious reasons. And I think that being able to sit down and have a conversation with somebody who works in public health can kind of take away some of those fears and those hesitancies.
Absolutely. And that's why, we try to be out as much as possible,
Right.
meet people where they're at and talk to them about the vaccines, because individuals are hesitant because they might not know what ingredients it has or
Right.
what type of reaction their body might have with the vaccine.
Right.
So just putting, meeting somebody from the health department or somebody knowledgeable on the vaccines puts people at ease.
Right.
So
Exactly.
I hope that we help answer questions and
Right.
yes.
And I feel like you're more approachable than, oh, I'll make an appointment and go walk into a doctor's office. And you kind of feel like you're taking up your doctor's time where they should be spending time on something else.
Yes, I can see how that could be intimidating.
Right. Yeah.
Where, you don't want to take up people's time and all that. So,
Yeah. So I've been so impressed by the people I've met through public health, including you, obviously, and
Nice
Kim
to meet you.
Bernard. It was so nice to meet you too. We talked when I first met with Kim. She wanted to get involved in the community night so badly.
Yes.
And we aren't having a community night this week, but on September 9th, we're doing a karaoke night.
Oh, that sounds exciting.
It's so exciting. I feel like it's going to be massive because
Awesome.
we're having it in the dance studio upstairs. So we can fit a really large amount of people up there.
Absolutely.
And, we can really belt it out and dance.
Yes.
And I'm just hoping that enough people know to register so I can have enough food for everybody. That's really my concern, but we'll just order double. Whatever you expect, order double, save the leftovers that you have and
Exactly.
hope for the best. But Kim set a date for public health to come host a trivia night, I think,
Yes,
for community
absolutely. I
night.
think we'll be there at some point
In October.
Yes, we'll be there in
Yes.
October. We'll host a trivia night. We're looking forward to it.
Yes, I'm
So-
also looking forward to it. Oh my
Yes.
gosh, I'm so excited. The
Yes.
community nights have been pretty much filled to capacity every
Wow.
time
That is
that we've
amazing
had
to know.
one. We've had 3,
Yes.
and each time the lowest amount of people we had 15 out of 20 people,
Wow.
which is still pretty good.
Absolutely. And do you get feedback online, or do people email you to join in? Or how
Yes. I feel like it's been really overwhelming for me when partners like public health say, oh my gosh, this is great. Can we come in and host one? That is always really reassuring to me because for me, it's like, okay, I'm doing something right. That
Absolutely.
the community partners want to get involved. They see this as a chance to meet people and just be able to shake some new hands and look people in the eyes and make connections with the community. So
Exactly.
that's really exciting. And a lot of people will hear about community nights and say, okay, what do you have lined up? And I say, oh, well, it's whatever you want. And it's whatever I want. So the karaoke night came out of, we were
Yes.
at tie-dye night, which had 35 people.
Wow.
It was packed.
Way
we
more
had
than you expected?
babies. Yeah, way more than I expected. There were babies there. They were so cute. We had people of all ages there doing
Wow.
tie-dye because that's something
That is
everybody
amazing.
can do together,
Absolutely.
And I was talking to them all. I said, I hope you guys don't mind, but while I have you all here, what's something that you want to see next time? And I was listening, I was saying, we could do another cooking class, we could have a karaoke night. And when I said karaoke, everybody just stops and
this is what we
smiles
need to
at
do.
me. And I said, okay, karaoke. And they're all like, yes.
It is.
And they're pointing at each other like, she has the best voice I've ever heard. And, oh, I work with her. I've heard her sing. She has to come. So
That is
a lot
awesome.
of people have been excited about it. And I can't fathom that today is the last day of August.
It flew by.
Summer is over.
And I'm sure we were both very busy throughout the summer that it just...
I know. Yeah. I can't believe it. Back to school.
Yes.
That's a really stressful time for a lot of parents.
Absolutely. And right now we're actually getting a lot of phone calls to schedule immunizations. Mm-hmm. A lot of children are trying to catch, the parents are trying to catch up their children on vaccines, get them up to date.
Yeah.
And it's stressful all over the place
right
now.
And especially too, some of the schools, like freshmen will start one day and then sophomores start another day and kindergarten starts one day, but second grade starts a different day. So if you have kids at all different age groups, that's a lot. That's a lot to keep track of. Our preschool program doesn't start until October. It starts October 3rd.
Oh, interesting.
And we're only running it on Mondays and Fridays from 8 a.m. to 12 p.m. And it's open for any children between the ages of 34 months, so almost
3 years old.
Almost 3 to, come on, Jess, you know this, 5, but haven't been to kindergarten yet. And we've had a good amount of interest in signups, but I also want to make sure that we're reaching kids who maybe they don't speak any English at home, and this is an introduction for them to English so that when they get to kindergarten, they have a little bit in their back pocket,
Absolutely.
And so those are the types of outreaches that I've been trying to do.
Absolutely.
And we've, registration is still open until September 20th, so we're still accepting.
Yeah.
We also have after school programs that are going to be happening at the center.
Nice.
So the preschool is from 8 a.m. to 12 p.m. And then after school programs will be probably from 2:30, 2 or 2:30 whenever the kids get out until 6.
Okay.
And it's just kind of like a drop-by system that they can stay and do their homework. They can stay and do the activities. They can join a dance class upstairs. There's going to be a lot of different options for them.
That's amazing.
But I can't believe it's already time.
It's almost there. It's almost there.
It's already time.
Is there any cost to attending the class?
Nothing. Nothing.
Wow, that's great.
Costs anything. We're going to have snacks available, 2 snack times at the preschool program, because I figure it gets out at noon. So parents probably want to pick up their kids and then have lunch. Right. And it doesn't really make sense to be in the middle of eating lunch and kids are getting picked up. You don't get to finish your food. So we'll have 2 snack times, and then we'll have snack time at the after school care as well for those kids who maybe didn't get to eat as much at lunch as they wanted to. I know when I was in school, I was talking blah, blah, blah. The whole time during lunch, I never ate anything. So my poor mom would give me snacks and I would eat them at like 4 p.m. before she picked me up. Oh yeah, I ate my snacks. Don't worry about it.
Absolutely.
So I want to be sure that those kids have that opportunity, but nothing costs anything.
And that's amazing that you have this program for the community, because a lot of the times daycare might not be affordable for every family. So having those 2 options, that might be liberating for a lot of families.
Right. Thank you. Thank you.
Amazing.
And I studied early childhood education in school, along with I studied education and business in school, and what I learned was exactly that childcare, quality childcare, is unobtainable for a majority of American families, never mind in Nashua, just across the United States. Quality childcare is kind of held for privileged children who their parents are able to afford that, or a scholarship. Sometimes they have scholarships, but you can't always rely on that because those are usually grant funded. So it's a lot of competition,
And there might be a lottery system, and you might not get called for that.
And then what do you do, because you have to go to work. So where are your kids going to go,
Exactly.
And so I wanted to make sure that it was 100% free, that the community center is there. And the only way I'm able to do it is through volunteers. Like we were talking about, there have been so many people who I say, do you like working with kids? Do you want to help them do their homework? Do you want to run games and activities with them after school?
That's
and
amazing.
The response has been really positive.
Absolutely.
And I've also partnered with 21st Century from Dr. Crisp right
Wow.
next door, and they'll come and do activities sometimes with their kids.
Yes.
So the kids from Dr. Crisp can get familiar with the center as well.
Wow, that is amazing.
Yeah.
So you're bringing a lot of experience to the table, and it might be like a more personal feel as well, where people from the community like want to be there.
Right.
They want to help out. They want to help out these children. So that's
Right.
amazing.
I want people to know that that's exactly what the center is for, and I want them to know that they can take some ownership over it and say, oh, I've always wanted to start a tutoring program. Oh, wait, I can. I just needed a space. Now I have one.
Yes.
Or if adults wanted to start a group together, kind of like what we were talking about last time we met at the center with the fatherhood group.
Oh, yes, we did. We were talking about the fatherhood group. We're excited to plan that and get individuals together and talk about our experiences and connect people in the community.
Right.
Fatherhood can be very difficult.
Yeah.
I have a 3-year-old child at home, and there's plenty of books out there to learn on how to become a parent. But when you have your child right in front of you, and
dripping in something,
yes.
What do I do with you?
Yes, exactly. There's moments where you want to reach out to somebody with more experience, or just get support from other people.
Right.
You might not know the answer to it right now, but maybe somebody in the community has gone through that experience.
Right.
And they might have a suggestion or maybe some tips that you can. So that's what we're hoping for the fatherhood group.
Yes. I am so excited, and I'm most excited that you really, again, took ownership over it and said, this is a need in my community. Heck, I need this.
Yes.
I'm going to do what I can to make this happen.
Absolutely.
And I've heard that from a lot of dads that they tell me that unless you have family or friends from some other type of social structure, whether it's work or you're a part of a club or whatever, meeting new dads is really hard. We don't really have a lot of spaces for that. We have mommy and me groups.
Exactly.
It's more common to see that than a fatherhood group.
Exactly. And I really hope we get a really good turnout, even if it's a couple dads. That would be amazing, because we can give each other ideas and make each other feel supported. And it would be exciting to see more of these groups available to the community.
Right. And
Yes.
I think one of the things that I really appreciate that you recognize is that the dads don't necessarily have to be a biological dad either.
Correct. It can be an uncle. It can
Right.
be a foster father.
Right.
Any individual that is raising a child, or they're
About to raise a child.
about to raise a child you're expecting, or you're planning for the future. You want to get more insight for the future and like learn from these experiences.
Right. And
So-
even dads who their kids are adults and
Yes.
have long left the house, their insight is valuable too.
Exactly. Just imagine you might hopefully we get dads with 30 years of experience. So
Right.
we'll learn from that, and what they recommend. And sometimes we have like things that we regret or things that we could have changed in the past. So maybe if we learn from other people's experiences, we'll be able to make better decisions. And
Right. And maybe
Exactly.
even pull in the expertise of other community partners too.
correct.
If somebody says, oh, I have this great program for dads, can I come and present?
Yes.
Yeah. But
Exactly.
also, we got to leave time for snacks.
Yes.
We have snacks and discussion
Yes.
so that the dads can hopefully become friends or make one friend that even when the group isn't meeting, maybe you guys get each other's number and you can text each other like, hey, is your son going to do soccer too? And maybe you'll see each other there,
Absolutely. So like try to find things in common, and we can plan a session where we could do something that we have in common, and then get to know each other, make it more comfortable.
Right.
One thing that I've noticed too is like we can have neighbors here in our communities and not know them for years.
Yep.
Not even know their first name.
Yep.
And I feel like what would really build a neighborhood is knowing the people that are around you.
Right.
And trying to share common experiences and
Right.
whatnot. So
Right. And I am so excited.
Yes.
I'm so excited to see that happen. And for me, I think especially with again with school starting and after school starting, the way I think we can get dads in at first is hopefully through the community festival.
Yes.
Which we talked about a little bit when we met.
Yes, I would love to know more about the community festival and
it's a huge undertaking. And when I first started planning it, it's on Saturday, September 17th. And I did not know
there's a million events.
that there's a million events in Nashua happening that day.
Yes.
But I have 20 volunteers for that day.
Oh, that's really good.
So there's nothing I can do because they're coming.
There's
So
no
I'm
going
going
back
to
now.
use them, you know?
Yes.
So, and it's all going to be inside, so I don't really have to worry about a rain date or anything, thankfully. But so the idea behind that event is I'll have 20 volunteers from Riviera University downstairs providing childcare and different activities for loved ones. And then, like we were talking about, any caretakers, like whether you're a parent, whether you're a foster parent, you're a grandparent, aunts, uncles, teachers, nurses, if you care for other people in your daily life, this event is for you.
That is amazing.
And I think at first I had a hard time marketing it because people say, okay, you know, community festival sounds fun. What are we doing? And it's such a packed event that I couldn't really pick just one thing and say, oh, you know, this event, it's like that, because it kind of has pieces. So the idea is that caretakers, so the parents, grandparents, whoever, will be upstairs. And I do want to mention it's upstairs. We don't have an elevator. So that upstairs room is not handicap accessible, but everything downstairs is. But those who can go upstairs, and there are activities there so that you meet, like we were talking about, you meet your neighbors, you meet other people who are caretakers that are going through the same experiences you have, that just give you a little bit of solidarity and say, okay, you know, you have a teenage son too. You know what I'm going through. It's crazy.
And I feel like they'll be able to talk about their experiences. And maybe recognize that, you know, you're going through burnout. You know? You might need a break at this time. You might need somebody else to step in. So having this conversation will help people realize, you know, maybe you need a little extra support. Or maybe you need to step out of the situation and
take a breath.
So that's amazing that you're doing this.
Thank you. That's what I'm hoping is that people see this event as fun. There are going to be some educational pieces to it because I do want to share resources in the community just in case people don't know about them. But primarily, I want it to be fun games and activities for adults to meet other adults and make friends and have like an hour where you're not in that caretaker role. You have an hour to have fun and meet new people. And then once everybody finishes that hour, they would go downstairs where the child care is for either children or if you have a loved one with Alzheimer's, with different disabilities that maybe it's hard to leave the house. We'll have activities for them too. And we have our 2 rooms downstairs. We have the children's classroom and then the adult classroom. And we're going to have 2 different activities going on for the next hour in there. One of them is a discussion being led by a community member who's also a mom, who she does a lot of work in diversity training, social emotional awareness, and she's going to be leading tangible tips that you can do when you're overwhelmed, when you're stressed. So that'll be one room. And then the other room will be soft movements that you can do. Everybody would do these activities together. So people can choose what rooms they go to. That'll be about half an hour. For the last half hour, we'll have snacks and giveaways. You know, do you need school supplies, anything? And then that's it. It's only 2 hours. People can go to the other million events that are going on in Nashua. But that's my idea.
Now, if you get a real good turnout and people want to see you again, will that be something that you would like to do once again? If it's
I would absolutely. If the parents who, were doing the activities upstairs and say, oh my gosh, it was so nice to talk to people my own age and, do some activities.
Yes.
Can we do this again? I am always up for it. All I need the volunteers.
Okay.
And I need to find the funding for the food. And that's all that I need to do.
Okay.
But I'm always, anytime, like the fatherhood group, 100% I'm on board. Let's find out how to make it happen.
Yeah, absolutely. And likewise, if I need to spread the word on the caregiver group, we're doing that.
Woohoo!
As well. So,
yay, thank you. Well, thank you so much for coming here.
Thank you, Jessica.
I'm so excited. We got our community festival coming up. We got the fatherhood group survey that we're both going to be sending out. So people will just, you have no option but you take it because we're going to be sending it left and right.
Absolutely.
And
so
we have that community night. Yes. Everything starts with community. So I have to pause afterwards and say, but I said festival, community night, that's it. Yeah.
Absolutely. So we're looking forward to it. We're happy to work with people out in the community.
Right.
We want to connect other individuals in the neighborhood as well. It doesn't necessarily have to be with us.
Right.
But maybe making a good positive connection out in the community you live in.
Right.
So.
And hearing from individuals what they want to see. Because the fatherhood group, we've both heard that. From people in our lives that they say, if this happened, I would go.
Yes.
Or if that was an opportunity, I would take that.
Absolutely.
So if anybody has any ideas, they can always reach out to either of us, Public Health or the center. And, we're working together. So maybe we can do it together.
Exactly.
But thank you so much for joining me. It's always a pleasure to see you. I'll see you again soon.
Likewise. I'll see you soon.
Yes, thank you. And thank you so much for spending this time with us. My name is Jessica Hagg, and I'll see you at the Arlington Street Community Center. Bye-bye.